Good evening, everyone. Welcome to Moving the Needle Loud and Clear. I'm Dr. Olajide Williams, founder of Hip Hop Public Health. We're deeply grateful for our sponsors whose support makes this campaign possible. Thank you to our board members for their vision and their leadership, and to the incredible Hip Hop Public Health team for making this evening happen. So hip hop has extraordinary potential for public health communication. It is not only a global language of youth, but it's also an economic powerhouse that shapes markets, trends, and behaviors worldwide. As a $50 billion cultural industry influencing fashion, technology, sports, and advertising, hip-hop commands an unparalleled level of attention among today's youth. It carries authenticity, more trust and credibility than many of us in the healthcare industry can summon, especially in underserved communities. Hip-hop's rhythm, rhyme, and storytelling makes complex health information easier to learn, to remember, and to act upon. And the evidence supports this. Through rigorous research, we and others have opened a window into hip-hop's untapped power to inspire health literacy. We have shown in peer-reviewed journals what the streets have long known. Hip-hop can help us cut through the noise. In hip-hop, moving the needle is what happened when a DJ scratches the record. A tiny disruption that transforms the entire track. In that same spirit, Hip Hop Public Health uses hip-hop to transform scientific concepts like disease prevention or symptom recognition, and so much more, into vivid, actionable metaphors that spread rapidly through peer networks. We remix the evidence on public health turntables, bridging labs with classrooms, clinics with street corners, so that from child to parent, the truth of a health matter is culturally accessible, actionable, resonant, so that the least among us hear it loud and clear. This is why we are here today, to support the launch of our Moving the Needle campaign, to lift the signal above the noise, so that truth travels farther, inspiring every mind, especially those long disenfranchised by inequity and exclusion. And now, let's bring our extraordinary speakers to the stage. Chelsea Clinton. Chelsea Clinton is Vice Chair of the Clinton Foundation and the Clinton Health Access Initiative, a public health advocate, storyteller, educator, and mom. She tackles vaccine hesitancy, promotes health equity, and brings the same energy to her podcast, This Can't Be True with Chelsea Clinton. Tonight, she'll guide us in how truth, courage, and creativity move the needle loud and clear. Chuck D. So Chuck D needs no introduction. Legendary frontman of Public Enemy and Grammy Lifetime Achievement Award recipient, Rock and Roll Hall of Fame inductee. He's also an activist, an author, a visual artist, and an innovator. He uses his voice to champion civil rights, media literacy, and cultural empowerment. Tonight, he's here to show how music and truth can cut through the noise and inspire action. Dr. Tom Frieden.
Don't believe the hype. Don't believe the hype.
So Dr. Tom Frieden, former CDC director and CEO of Resolve to Save Lives, has dedicated his career to stopping deadly outbreaks and saving millions of lives. He is the author of The Formula for Better Health, which was recently released, which takes readers inside life-saving breakthroughs and strategies. Tonight, he'll explore how evidence and clarity empower communities to act on accurate health information. Dr. Uché Blackstock. Dr. Uché Blackstock, oh, by the way, we asked all the panelists to pick their favorite hip-hop songs that they wanted to walk out to. So Tom's favorite was Don't Believe the Hype. Dr. Uché Blackstock is a physician, thought leader, and founder of Advancing Health Equity, helping healthcare organizations embed equity into leadership, strategy, and clinical practice. She is a former MSNBC medical contributor, acclaimed writer, and author of the New York Times bestselling memoir, Legacy: A Black Physician Reckons with Racism in Medicine. Tonight, she'll share how culturally grounded health information can resonate loud and clear where it's needed the most. And now, please join me in welcoming our moderator for this evening, Chelsea Clinton, who will guide us through a conversation about truth, about cutting through the noise, and about ensuring that communities everywhere have access to accurate health information. Over to you, Chelsea.
Well, thank you so much, Dr. Williams, for that introduction. I think I've only been asked twice in all of the many years that I've been lucky enough to be part of events and dynamic and hopefully informative and empowering conversations. Only twice have I been asked to pick like walkout music. Once I was doing an event that was focused on youth mental health, and I was asked like, and what song meant a lot to you when you were like 13 and 14? I was like, what song didn't mean a lot to me? I was 13 and 14, like everything felt very important. But really, it's just such a joy to be in community together this evening and to be spending time talking about such a critically important issue when particularly mis and disinformation are actually quite loud at the moment. And so I just feel like because we're here under the aegis of Hip Hop Health, we have to start with the person that I'm fangirling hard quietly on the inside by sitting next to. Chuck, when did you feel like your platform could be more than just kind of entertaining and activating kind of on a broad civic and social level, but actually could be quite important for public health?
Well, and thank you, Chelsea. I happened to be a college student in the 80s during the years of R&B, Reagan and Bush. And I knew that rap songs had to be able to songs are filled with words to say and do something. And I got out of college in '84. So I was fortunate to do studies on Noam Chomsky that made me come up with Don't Believe the Hype in 1987, 1988. That's basically what that song meant, to challenge information, which also meant to challenge disinformation and misinformation. And what I meant by that is not, all right, you're making a rap song, you got beats behind it, and people automatically says, don't believe any information. I wasn't saying that. I meant to challenge information in the song. And if they didn't pick it up right away, I knew that songs permeate society and you could pick it up later on your stage in time. That's the beautiful thing about reading. You don't have to comprehend it the first time reading, but if you go back to it, you could get some comprehension along with reading. What I also found at that particular time, to find out how it can assist a lot of different aspects of our lives, is that we made no bones about being headline news, but we wasn't the scholarship. The disrespect of scholars is what I also happened to see at the particular time, which we opposed. We said, no, we could spark you going to an actual scholar or actual doctor or somebody who's really doing work in the field and be detailed about your time and diligence to say that, wow, they're doing something and I just can't do it overnight. They put detail and work in it. So yes, we made people think about something, but we did not teach them within a 2-minute, 35-second song. We had to defer that light and that brilliance to people that are doing real things in real time. We wasn't politicians, but we were more like the prism that actually spreads the light to all those different areas. So that's when I realized in the 80s that a rap song could do a lot more, and to be able to lighten people, places, and come up with things that made us go forward.
You know, looking now at Tom and Uché, I think what Chuck said is so powerful. Encouraging people to ask questions of the experts who hopefully have the answers that we would hope all of us would have access to, particularly when it relates to health. I think we're living in a moment now, though, where people are not necessarily going to experts. They're going online, or maybe they're going to their friends who have been online and asking, profound questions about kind of their health broadly, diet, nutrition, vaccines. I wonder, Tom, just moving down the line, and then Uché, how do you think kind of arts and culture, but particularly hip hop, can really help us encourage people to ask questions and also, just as Chuck said, direct those questions to the experts who have the answers that are really more likely to be healthy for them?
First, I think we have to think, what can we learn from one another and with one another? And one of the things that I think public health needs to, and health needs to learn from cultural progress and cultural trends is market segmentation and understanding your market, right? So there isn't one message that's going to work for everyone, and there isn't one message that's going to keep working for groups over time. One of the real challenges in the public sector is that we don't have a feedback loop. If you release something and nobody downloads it, nobody buys it, it's not resonating. If we do a campaign, we have no idea if it's working or not unless we have a way to track it. And that's what I discuss in the book about see, believe, create. We have to see what's really happening, believe we can make change, and then create a healthier future. In terms of getting people to listen to experts, I'm not sure that's the right way to frame it. I think we have to start with that everyone is the expert on themselves. And we're there, if we have specific knowledge, to share that knowledge so that they decide, you decide what you want to do. But you should do that based on facts, not fiction. And we're now dealing with a fire hose of fictions, most of which are driven by profit. And so I think we have to start with, what are people upset about? And those are valid concerns. What's in our air, what's in our water, what's in our food, who's paying who to say things that are affecting what I experience? Those are real, valid concerns. But to address them in a way that leads to a healthier future means recognizing that there are facts. Even if they're suppressed or twisted or cherry-picked or misused, they're still facts. And we can provide that as a way of empowering people.
Uché?
Yeah, so, and it's funny because Chelsea and I were on a panel together a few weeks ago talking about sort of trust in a lot of these same issues. But, I grew up in the 80s and 90s in Crown Heights, Brooklyn. And, and I talk a lot about this, but, I saw my mother, who was a physician, and other Black physicians really doing what we call health equity work when we didn't have that expression, working in service to the community. But the big piece about what they were doing was that they were from the community and they understood the lived experience of community members. And so that's where I see the intersection of arts and medicine, is that, artists like Chuck D talking about experiences that listeners can relate to. And it's that relatability part that I think within public health and within healthcare that we really alienated communities. And we need to really come back on board to recognize that, when there is a crisis that happened in 2020, people aren't going to start listening to you because you're the so-called expert, right? And like you said, everyone is an expert in their own body. I'm an expert in a certain field of study, but we want to meet people where they are, right? We always talk about that. And I think there is an accessibility, there is a likability to, just the music. You had the music of my childhood. Like, when I hear it, it resonates in me, right? And so, I think it's important that we don't stay in our silos, that conversations like this, where we're exchanging ideas across disciplines, really important to meeting people where they are.
I think absolutely. As Tom said, we still have lead in water and in paint. We still have arsenic in the ground. We still have places with high particulate matter in the air. We still have people who are expected to wait months after initial cancer diagnosis to be able to have their first treatment. It is unimpeachably evident that we continue to fail at both a public health level and also many individual patients. And I think in this reality, there has been such a ferment, though, as Tom, I think you rightly said, for many people who respectfully have not gone to medical school and do not have the levels of expertise that the two of you have in your areas of study, who are motivated by profit, to give people easy answers of take this and it's going to unvaccinate you. Take this and you're going to live to be 100, right? Or, take this and your malignancy will disappear in a month. And so I do think, in this moment, people with credibility in communities is just all the more important, because people do have these parasocial relationships with people that they see online who they feel like are talking to them all the time. And so, Chuck, I wonder, as someone who's just been such an extraordinarily powerful communicator, as Tom said, you've had a lot of feedback loops, right? You've sold many, many millions of records. You've won many, many awards, many more than Dr. Williams mentioned in his introduction. What advice do you have for the public health folks in the room about how to continue to think about communicating in ways that feel authentic to us, recognize that, yes, people are experts in their own health, but also, Dr. Blackstock and Dr. Frieden have real things that we could benefit from if we're listening. How do you think we think about this more creatively?
Well, like Doctor said, be the expert on yourself. Know who you are. The loudest in the room, or the loudest in the stadium, or the loudest on any screen, since we're all screenagers now, whether we like it or not, for 8 to 80, we're screenagers. So what's bouncing out of those screens might anoint people in their regular lives to call themselves what they feel like calling themselves. I mean, I come from the music business where people call themselves doctor or whatever, you know what I'm saying?
Wait, did you ever call yourself doctor?
No.
You're like,
no.
I
and I got one of
that
those
one.
honorary doctors from my college hanging on the wall, and I still wouldn't call myself doctor. We have a statement, I think you're familiar with, Ms. Clinton. We call it, "Don't get it twisted." We're in twisted times right now. When you talk about administrations or countries that say they're going to get rid of books, the difference between a book and a screen is that a screen could appear to disappear at a loss of power, snap of a finger. A book stays frozen, and it takes time to get into it, And if you can't read it or comprehend it, somebody will actually tell you to come in, STFU, sit down, take notes, and listen, and don't interrupt me. And then you'll begin to figure out what those words and what that text and that particular language will teach you to separate yourself from a normal human being with your time and a scholar who goes for scholarship and then teaches. Scholars actually read the good, bad, and the ugly. We regular people read what we like. They got to read the good, bad, the ugly, and then have a conversation to you about whatever it specializes in. We're in a society that just kind of like disowns that. And so what, I went on YouTube and I know how to fix myself. And we fall victim to trying to fix the Ford Fairlane, with no tools. So we have to be able to say and be honest with ourselves. Entertainers on the entertainment field, we could be the loudest in the room, but we better point to some real professional, skilled people. That even goes for politics too. Like, your parents' administration wanted free health for everybody in 1993. I was 33 years old. I'm in the music business. We don't have no health plans. That sounded like a good-ass idea. Then we don't want to pay attention to the politics of big business trying to get rid of it for this reason, whatever. All I know is I look in the neighborhoods, no matter where I travel, whether it's on tour or where I live, and I'm saying, damn, that sounded like a good-ass idea. But the higher up you get into the fights, into the filibustering, and the soapboxing, and the DMV arguments or the Beltline in D.C., it confuses the public. And when they get into an area of sickness, we're in a time that eventually led to not believing what a doctor has to say. And not a doctor that came through, a rap record, but a doctor that happens to look at your charts and says, you in trouble, dog. So, screen, we're in a time right now, and now we're on the cusp of, and you all hear it, we're on the cusp of super AI, which you want to talk about 4 years ago, deep faking. You got to go into any screen almost disbelieving everything. So if you don't have the eye to eye, the head, the ear to ear, the heart to heart, the mind to mind, and then have the ability to STFU and then listen and pay attention, they're gonna be in trouble. Doc tells me, you got 100 years to live around with. I don't want to say play around with, but you got 100 years to live around with. We've been dealing with a catastrophe in my genre, in the art form, where the lifestyle has been followed so hard for 45 years that the 100 years to live around with is ending up 38, 45, 31, 47, 53. Wow. You need a scholar to break that down for the masses. But big business wants to turn the masses into them asses. That's what they've been successful in. Loud voices, and they just moved the M over. The masses, them asses. So the best communicators are not your best teachers, and they have to be able to be honest, straight up, remove the ego and says, I'm not the best communicator on that. However, these are the people you need to pay close attention to. You might hear them out or tune them out, but it can't be me. We gotta be honest with that.
We have to applaud. Come on, yeah. I think one thing we also have to be honest about, is that
I'm just gonna say
the,
it,
yeah,
Ms.
please,
Clinton. Real people
you can
do
call me
real.
Chelsea.
No, Chelsea.
You're Chuck D. You can interrupt me all the time.
Real people do real things. We've gotten away from that. We've gotten away from applauding real people doing real things. They shouldn't have to be like the last 3 minutes of a newscast. It's like, oh, by the way, we got some good, things to show you, and it's 3 minutes left. When did we get away from real people getting applause every day? We got to get back to that. And it's got to be the entertainment that points the finger yo, this is a real person. This is real people. They've been feeding people in their community for 40 years. We don't, and we don't have to give them the badge, but they probably don't want the badge, but we should salute that. And if we don't get back to that, with AI and everything coming at a super rate that it is, catastrophes are bound and inevitably ready to happen in mass amounts. Sorry to cut you off.
No, please. You have carte blanche forever. May this not be the only event we do together, or only conversation we have. Although as I was listening to you, talk about like our great artists who do, by definition, if they are our great artists, cut through the noise and help not only shape but really kind of provoke conversation. Our great artists look more like our country, Uché, than our doctors do. Right? We have over 1 million doctors in the United States of America, and our doctors don't look like the United States of America. I know you've thought a lot about this, and I wonder if I might humbly ask that you give us a little history lesson.
Okay.
and
Yes.
tell us how and why
Yeah.
that history is so important to this moment of destabilization and understandable mistrust that's made
Yeah.
all of us more vulnerable.
And I want to say, I think the issue of mistrust has several layers because, and I'll get to the history lesson, but I also want to say that, we want people to have the information that they need to make informed decisions for themselves. Like, we don't want to be paternalistic, but I feel like we've gotten to the point where people don't know where to go for accurate and responsible sources of information, right? And then we have dominant voices putting out misinformation. It's like the same,
we have the government
right? And
putting out
yes,
misinformation.
yes, right? Exactly. And we have communities that are hearing all of these messages and not knowing who to listen to, right? And so I think part of that I get because we have a history where, actually, let me first ask, who's heard of the Flexner Report? So I see probably like a quarter of the people in the room have heard of the Flexner Report, but the Flexner Report of 1910 is one of the reasons why today we don't have a healthcare workforce, not just physicians, but nurses and other health professionals that reflect the population of this country. I would say by 1905, there were about 1,500 Black physicians in this country, and they had been trained by 7 historically Black medical schools. In 1910, the Carnegie Foundation, the American Medical Association, commissioned Abraham Flexner, an educational specialist who actually was known to hold racist views of Black people. He felt like the only reasons that Black students should be in school with white students as sanitarians to prevent white students from getting sick. They commissioned him to go around to all 155 US and Canadian medical schools and assess them against the gold standard here in the US, Johns Hopkins. So what were their admission criteria? What were the percentage of physician scientists on faculty? So looking at just sort of how rigorous the curriculums were. And so based on that report, some predominantly white schools closed, but also 5 out of 7 the historically Black colleges were closed. So 5 were closed, leaving behind Howard and Meharry in 1910. The Journal of American Medical Association, actually in 2020, published an article that estimated if those 5 schools had remained open, they would have trained or educated between 25,000 and 35,000 Black physicians. 25,000 and 35,000 Black physicians. That number, think about that number, but also the issue also is that still to this day, historically Black medical schools educate the most Black doctors. So that's the other issue. They're still doing the heavy lifting. But think about how many patients those tens of thousands of physicians could have treated. Think about the research that could have been done, the communities that could have been served. And so we know the Flexner Report impacted actually midwifery, it impacted dental professions and other allied health professions. So it really made a difference. And so when we look at statistics now in terms of, or just even studies, around, observational studies around racial concordance in care, meaning the clinician and the patient are of the same racial background, we know for Black patients and patients of color, it makes a difference. We know that people are more likely to follow their physician's recommendations. They're more likely to leave the encounter with a positive feeling. We know that even in one US county, in a US county, having one Black primary care physician actually improves the life expectancy of Black people living in that county and actually overall life expectancy. But the fact is that only a fraction of US counties even have one Black primary care physician, right? So we have to think about all of the reasons for the mistrust. And I often talk about how, medical mistrust is framed as something that the patient has, the community member has, and I like to reframe it as institutional untrustworthiness, because our country has had a history, and it's not just, people mention Tuskegee, it's not just Tuskegee, it is the foundation of what medicine is in this country, has been founded on using and exploiting Black bodies from slavery. To make discoveries that were very important, but still done in the most horrific ways. And so we need to have, so many layers, but we need to have, to reckon with that, we need to have acknowledgement of the harm, we need to have what repair still looks like. And this is why hip-hop public health is so important, because the work that you do is forming that relationship with community members to say, we see you. We see you, we see what's going on in your life, and we want to co-create with you, right? Right. It's not we got to tell you what to do. We want to power share with you, right? And that's something a lot of health-related organizations don't do. So I could go on this forever, but I also just want to say that we need to think about the public and different demographics and why that mistrust is there. And think about what are we doing, and what are you doing in all your respective roles in academia, in biopharma, and how are you engaging with communities to really center their voices, center their concerns, right? Are they on the boards of your organizations, right? What does health equity look like to them? We know we think we know what metrics we're using are important, but what does good health mean? It can mean more birthday parties, no missed retirement parties, more graduations, right? That's living. So I think we really need to think about how we're communicating about health to and engaging with communities.
Please.
Could I ask a question? Like, I was born in 1960, so I remember the doctor being in the neighborhood. We had one doctor as a kid, and we didn't have no money, my family, but it was a doctor that I had all the way up to 10 years old until we moved further out in Long Island, Roosevelt. But that was a normal case. What was that? What caused that turning point from the physician in the neighborhood that would make house calls and house visits to this area that we're at right now, where, you definitely have more sickness, and people talk about the foods and the air and all these other things, but what was that turning point that took it out of the neighborhood, from the neighborhood physician into this?
To the hospitals. I'm gonna actually let Dr. Frieden probably take that, right? Yeah, you take it.
Well,
Did I ask a hot question or something?
I probably could say it in a few words. No, but we have a for-profit healthcare system. We have a system that is not, people, to have your own private practice now, it's very difficult because of insurance companies, because of hospital consolidations. It just is economically not difficult to survive as an independent, primary care or practitioner.
So there's not a quick answer to that, to be blunt. First off, we shouldn't romanticize the past. Lots of people didn't have a doctor. We were living shorter lives. There was less good stuff to do with healthcare. For all of the bad things happening today, We have better tools than ever in human history, better diagnostics, better treatments, and much better vaccines. But I'll tell you a story. My very first job was as a community organizer in the Mississippi Delta area. And I was working, posted to a community health clinic, the Douglas Community Health Clinic, a very interesting community. It was actually a community where they had taken families that had been sharecropping and given them land under a New Deal program. They had built a new community health center, and it was gorgeous. It was gleaming, new, and people weren't coming, and they didn't know why. So I guess even then I was worried about feedback loops. So we did a random survey of more than 350 households randomly distributed through the 10,000 person catchment area. And what we found was 50% of people didn't know the clinic existed. 80% of people didn't know that it had a sliding fee scale and you had to pay almost nothing if you didn't have much money. And virtually nobody knew that it had a van that could pick you up and drop you off. And the people who did know were the people who didn't need to know.
Okay.
There is something called the inverse care law, which you may have heard of, which is basically whoever needs services the most gets them the least, and vice versa. And to swim upstream against the inverse care law, you really have to structure things right. But we have in this country a healthcare system that pays more and accomplishes less than any other health system anywhere in the world. It would be really hard to pay more and get worse health outcomes. In fact, nobody does it.
Yeah, we are an outlier in the worst way.
Yes.
In that way.
Is every state different?
Yeah.
Is every state different?
Yes, there's a lot of differences among states, but the federal government and our overall healthcare system structures things, and I go into this. I want to focus on one particular health condition, which is high blood pressure, hypertension, because it is the leading driver of preventable early death in this country, and it's the single leading driver of difference in life expectancy between Black and white Americans. So it's bad for everybody, and it's particularly bad for Black communities in this country. In fact, about 2/3 of all Black adults in the United States have unhealthy blood pressure. 2/3. Now, high blood pressure is really bad, because with every single beat, every single second of every single day, the heart is pushing blood and slamming against the brain, the kidneys, the heart, increasing the risk of early death, early stroke, early heart attack, disability, dementia, and it's preventable and treatable, and we're not doing that. So why not? Well, because it doesn't pay. Plain and simple, because it doesn't pay. Look, there's a health system in this country that gets it right. It's called Kaiser Permanente. Their doctors are no smarter than other doctors, but their incentives are aligned. If they keep people healthy, they make more money because the payer and the provider are the same. In most of the healthcare system, if you're a dedicated doctor and you do a really good job and you get your patient's blood pressure controlled, you won't get a nickel more. And your healthcare system will make a lot less money. If you don't do that, there are going to be strokes and heart attacks, rehabilitation. Your healthcare system will make a lot more money. I do not think there is a single doctor in this country who wants their patient to have a heart attack or stroke. But we've structured our system so that that is the outcome. And we can, I think, change that and get back, because there was a reality. My father was one of those doctors. Your mother was one of those doctors, right? They were there for the community. They knew people. They knew whole families. They knew kids when they were born until they were adults. And that can happen if there's an economic incentive to make that happen. In Kaiser Permanente, you say, oh, well, if we have to keep people healthy, we need a team. We need not just doctors, but nurses and pharmacists and community outreach workers and social workers. And we're doing that not because we're kind and nice people, though. We are, of course. We're doing that because it makes economic sense. When I was CDC director, and I talk about this in the book, one of my big failures was the attempt to increase blood pressure control rates in the US. I got the White House to sign off. I got HHS to sign off. I got every national organization to sign off. I got thousands of community clinics to sign off. I thought we were going to do great. We started off at about 48%. We wanted to get to 60% control, and we got to 44% control. We moved the needle in the wrong direction.
Wow.
And it's ultimately because if it doesn't pay, it's not going to happen. And if we can change our healthcare system so that the interests of the doctors, because they want to provide good care, are the same as the interests of the patients and the payers, then we can have a healthcare system and a system that pays primary care doctors. Because the short answer to why that doctor isn't there, because they don't get paid. Medicare pays less than 5% of its total spending on primary care. If you are a wonderful primary care doctor, you work for 20 years, dedicated, you will make less than half as much money as a surgeon who graduated yesterday. And the only way we can change that is by changing the underlying incentives of the healthcare system.
Well, and, Tom, while you were speaking, I also was thinking, as similar to Uché, someone who grew up in the 80s and the 90s, we didn't rely only on the doctor as the single point of healthcare assessment, delivery, or communication. I went to public school in Little Rock, Arkansas, and I remember in my local public school, Booker Arts Elementary, every year we had vision screenings, hearing screenings. I could have gotten my routine immunizations in school if I weren't getting them at my well child visit. We had evidence-based nutritional information. Nifty Nutrition was the curriculum name. We had age-appropriate sexual and reproductive health education. We had fitness tests without stigma, kind of, which I think is arguably the most remarkable thing of what I just said, given kind of the zeitgeist of the 80s and the 90s. And if I were a kid in the Little Rock public school system today, none of that would be true.
Wow.
None of that would be true. And so I think it's also that we really have taken the public out of public health, which then also I think further explains, as Uché was saying, we do have many overlapping reasons of system failure for why people are not always ready to trust. And I think, as Chuck mentioned, with the rise of AI, and I would also humbly submit the ways that we've been failed by the social media companies, that all of this could just get all the harder. But yet, I don't want us to end on a downward note. I feel like we should kind of move more into optimism and action. And, Uché said that, after the Flexner report, we had 2 historically Black college and university medical schools. We're about to have our 5th open, Xavier, in New Orleans. We're still not back to 7, but anemic progress. And I do think, Dr. Frieden, that while certainly we don't have our blood pressure nearly controlled enough, at least I think we are seeing in some communities there is differential progress, often because we do have partnerships across the whole ecosystem. And I think thankfully, Chuck, we do have artists as well as athletes and other kind of culturally important and resonant figures along the market segmentation that Tom talked about, who are thankfully willing to talk about public health, even if it is to direct your spotlight to the people doing good work. So that's my kind of contribution of, like, we have enormous work to do, but we also have learned really important lessons that hopefully we can kind of learn kind of from and with together and continue to be kind of in purpose-driven community. I though hope that each of you can leave us maybe with one point of optimism of where you have seen kind of real effort turn into meaningful success. So Tom, when you're moving in the other direction, and kind of what you would want people to know about kind of what you think we all might be able to do together. And so I think we should give Chuck, our resident hip-hop expert, the last word. So maybe Uché, will start with you and then come down.
Let's see. I always try to be optimistic. I do, just by nature. But I think Tom mentioned them already, but I just want to give a shout out to community health workers because they are, so thank you. I don't know if there are any in the room, but they are underutilized tremendously in our country and utilized so well globally, right? Just able to really, they're from the community or are very familiar with the community. They help with education, prevention, even some minor procedures, but they are really able to meet community members where they are. And also, if people care more than about just the human part of it or the economic part of it, they actually are cost effective. Like New York City just did a study that showed using community health workers saved the city millions of dollars. And so if you're looking for a win-win solution, we need to really look at how community health workers, in terms of the reimbursement, making sure that they're covered, making sure that we have training programs for them, that they are able to receive health insurance and the benefits that other people receive that are doing great work, and really need to support the community health worker workforce because we could actually see some real differences across the country.
Agree 1,000%. When I was becoming a disease detective, an epidemic intelligence service officer, 36% of American teenagers smoked, and 6-year-olds could recognize Joe Camel more than Mickey Mouse. One of my colleagues proved that. Last year, it was down from 36% to 2%. When I became New York City Health Commissioner, tobacco was our #1 problem. And we documented that the rate of adult smoking was 22% and hadn't budged in a decade. Last year it was 11%. Progress required governments doing the right thing, activated civil society pushing and supporting governments to do the right thing, and rigorous monitoring to keep everybody on track. We can have that kind of progress with blood pressure. We can ensure that people are empowered to understand how deadly it is. There's really simple things you can do. Switch, unless you have kidney problems, switch to potassium-enriched low-sodium salt. You can get it on the internet, you can get it in the supermarkets. Just changing the brand of salt you use is going to reduce your risk of a heart attack and stroke substantially without doing anything else. Know your blood pressure and work with your clinicians to get it under control, ideally to less than 120/80. Anything over that is unhealthy. Don't let anyone tell you otherwise. It may be, for some people, it's okay to go a little higher. Maybe that for various reasons it should be higher, but for most people, lower is better. There really is a formula for better health. We see what the threats are, believe we can change them, and work together systematically based on facts and evidence to create a healthier future together.
Chuck?
And then there's the next chapter in this millennium. As kids don't smoke cigarettes and notice who Joe Camel is, now they're smoking screens. And now we got a mental health crisis and trying to figure out what's healthy and where's the toxins in that will take probably another body of academic study to free the mind, as they say. I think the point I want to leave with this is that artists are supposed to bring you to the table, bring it to the table so real people's cooking, and I'm just talking in an analogy speaking, could kind of learn you right once they brought you in. I was saying that, artistry, spectacle gets you in the building. Spectacular keeps you coming back for more. We got to understand that we're the spectacle. The spectacular is talking about the doctors, the medicine, the teachers, and all those things that keep you coming back for more. You get 100 years to live around with. Lastly, I like to say that artists being aware, I don't deal with a country. I've been to 130 countries. And you know a difference when you're in the airport and when you go into a country just by the crowd. Whether I'm in Lithuania and I come back to East St. Louis. I did both of those places touring with Guns N' Roses this year. And you notice a difference. And also, here's another thing. When you walk through airports, do you notice a difference in this country, with just, well, any country, but really with this country, you see people get ready to fly to Birmingham and people flying to Seattle. You say, wow, there's a whole different physical makeup, you know, and a public has to really be aware of the things that's in front of them in real life so they can possibly add logic to what they're about to learn for their own good. We're in a time where illogic has become the norm and, in fact, on the edge of being popular. And it comes to this thing called social media, which is a sock med, not good for you. So we as artists have to be aware of these things, but when we bark out, I think, you know, you follow the bark for a couple sentences and you keep it moving into your logical self. We are not meant to teach a damn thing past 1, 2, 3 sentences. We got to point to those that's doing the real work for real change and who are able to, as we say back in the day, learn you something. And that's where we're at. And this is on my own personal opinion. But as an artist, I say, you know, my eyes is open. You know, you're getting down in front of a crowd in Atlanta and you're getting down in front of a crowd in Sardinia and you're gonna see 2 different sets of human beings. So how do we gel this all together into a medical industry or a medical situation here in the country, but also at the same time reflects and has the ability to grow other places on the same level. That's where I think we're at.
I was very close with both my grandmothers. My maternal grandmother sadly passed away when I was 31. I spoke to her every day for the last handful of years of her life. Very sadly, in a different way, I lost my paternal grandmother when I was 13, and my paternal grandmother had just a kind of litany of sayings that when I was little, I just thought, like, what is she talking about? But certainly as an adult, they kind of have carved themselves into my heart and feel far more kind of salient to me than anything I might otherwise read on a Hallmark card, although not necessarily hear from my preacher or the artists who also bring so much meaning into my life. But one of the things that she said to me that I think about truly all the time is that if you see a frog on a fence post, it didn't get there by accident. We're all sitting on lots of fence posts that we may not have chosen. But unlike a frog, we can choose to get off and choose who to be in community with. And I'm just truly so thankful to be in community with all of you. This evening, I'm so honored that Dr. Williams asked me to be here. I'm incredibly grateful as well that we have experts like Dr. Blackstock and Dr. Frieden who are trying to help us understand more about our health so that we can make better choices for ourselves and our communities, and also are fighting for public health for when we need to make collective choices together. And Chuck D, thank you for being part of the soundtrack of my life, and thank you for not thinking that your kind of purpose or impact stops when you get off a stage in front of very big crowds, and that you chose to spend your time and your energy on this stage with us this evening. And thank you to everyone at the Lotus Club who's kept me well hydrated this evening. But really, thank you all so much. Please give our panelists another round of applause.
Give them another round of applause. Be careful. Thank you, thank you, thank you. Thank you, Chelsea Clinton. Thank you, Uché. Thank you, Tom. And thank you, my good friend, Chuck D. That was the chair. Thank you, everyone. Give them a round of applause if they leave the stage. So Tom said something that really was so profound when he said it. He said, an activated civil society pushing the government, pushing each other, and doing the right thing is where we make the change. And so I think that pretty much captures why we decided to do this event, moving the needle loud and clear. This event and this campaign, and the beginning of this campaign, is really designed to do exactly what Tom said, to activate everyone, to push everything that we have the power to push in the direction of truth, in the direction of accurate health information, so that we can protect the most vulnerable among us. You know, that inverse health relationship is really powerful. Most of us in this room don't have a problem accessing health information. But I'm sure that most of us in this room know people that have a problem accessing health information. And so it's not about us, it's about what we do with that recognition, what we do with the power that we have inside ourselves to move the needle in other people's lives. And so Hip Hop Public Health today, I believe that our work cannot be more important. Our ability to travel across sectors and bring individuals together, like Chuck, like Tom, like Uché, and like Chelsea, to have these types of conversations and translate these types of conversations into real action is critically important. And we hope to continue to move this work forward, and we hope you'll join us on this journey. And so, as we move forward, we're shaping our strategic direction to move this moment. Our goal is to enter 2026 deeper, stronger, and louder than ever before. And so please take this moment to see some of our work in action.
Now if he don't sound right, then he's doing the show. Sway when he walks, then he's doing the show. Slur when he talk, then he's doing the show. Call 911, cause it ain't no joke. Now X is for the face, and A is for the arms. X is for the speech, and T is for the time. Time to do what? Call 911. Time to do what? Call 911.
Let's talk about salt, baby. Let's talk about MSG. Let's talk about all the good things and the bad things that we eat. Let's talk about salt. Let's talk about salt. Let's talk about salt. Let's talk about salt.
I got the vaccine, you got the vaccine, they got the vaccine, we got the vaccine. We could get back to normal, let me inform you, let's all get the vaccine. It's about community immunity, I'm talking unity for you and me.
If Doc says it's good, then trust me, it's good. Now let's all get the
Talk to your family, your inner circle, and screaming and proactive, and it won't hurt you. We all want to live our lives the best we can be. Go check your colon. Peace, I'm Chuck D. Save lives, and peep the deeper meaning. Stand up to cancer and get a screening. Save lives, take control of your health. Get knowledge for yourself, and it's the real wealth.
I've been hiding in the shadows from the kids and all the babies. It's amazing, they go crazy, and the kids will always trade me in the salad dressing, ice cream in the muffins too. You can choose any topping and I'm there for you. Get your burgers and fries from Burgerland. I'm the villain that's hiding in the soda can. Hide and seek, he's the fool, I made a fool of you. It's true, I'm very proud of what I do with you. I got 99 names and Little Sugar's just one.
Thank you. So that work was co-created. It wasn't created by our health experts. It was co-created with the communities that want language that speaks to them. And so with that, I'm going to invite our incredible interim executive director to the stage, Denise Nelson.
So I can never beat G-Day, so I'm going to keep this short and sweet. I think when we were thinking about the launch of the campaign, we were lamenting all of the things that are happening out there, and we thought, and I knew, that we could be louder and clearer. We're already in classrooms, we're in communities. I heard a shout out up on the stage for community health workers. We're there with them. We can keep bringing our messaging, our campaigns, and help inspire health to everyone who needs it. So I'm actually knowing that in this room, as I was here before, we're all co-conspirators. We had a panel here telling us how they live their lives to tell that kind of truth, how to make sure that they bring that to everyone. And here we are, co-conspirators. You guys have already lifted us up in so many ways, but I invite you to help do more even today. I can't see the screen right now, but what we're hoping is that you might take out the sign for the QR code, text, tell your friends to do it, because we're just at the start of a campaign that is around how do we be louder and clearer. We're not fighting disinformation. What we're going to do is just give more truth, and we know where that goes.
Thank you so much. Thank you, Denise. So please join us. So we're right up against the hour, and I just want to close by thanking all of you for taking the time to come and join us at the Lotus Club. Isn't it such a beautiful club? It's just absolutely beautiful space. But thank you for coming to join us to listen to what I hope was an impactful panel. And I want to single out a few people for special thanks, people that are typically invisible during events like this. And that is the Hip Hop Public Health team who helped put this together. So let's give them a round of applause. Lindsay, Citra, Bernadette, thank you all so much for helping put this event together. I want to also thank the incredible Denise Nelson. Thank you, Denise. Thank you for your leadership. I want to thank DJ Flo for the music. DJ Flo, where are you? I want to thank all those who supported the event, our sponsors and our partners. Thank you all for your commitment to this cause. There's still a lot more work to do. So safe travels, happy holidays, and we look forward to seeing you at the next event. Thank you all.